Hello everyone, it's Taha. I'm a fourth year medical student, and in this video we're going to go over the investigation procedures of asthma. So in previous videos we've looked at the pathophysiology as well as the clinical presentation of asthma, and in today's video we're going to have a look at the different investigation procedures that are available to patients. So let's jump straight into the video. So we'll bring our beloved patient back, Mr. Whitecoat. All right. And now Mr. Whitecoat is wondering what are the different investigation procedures that are actually available to him that we can look towards doing that may confirm asthma as a diagnosis or may point towards a different diagnosis. So the very first thing that we need to consider is that asthma is oftentimes a clinical diagnosis, right? Now, what actually is a clinical diagnosis? A clinical diagnosis is where the doctor or the clinician will make a diagnosis based on the patient's clinical symptoms, right? So this means that the doctor will look at the patients within the symptoms, with the patient's symptoms, and will make a diagnosis based off just that without doing any further investigations. And obviously, we can imagine the symptoms may be very typical of the actual pathology itself. So that may mean that the doctor doesn't need to confirm or look towards alternative diagnoses. And asthma is oftentimes one of those conditions. Now, if a doctor does want to confirm the diagnosis of asthma, then there are a few investigation procedures that are available. So we'll jump into those right now. So the very first thing that we can look at is something called eosinophil count. Eosinophil count and FeNO. Okay, so eosinophil count and FeNO. That's the very first thing. There are four main types of clinical investigation procedures that we can do. So I'll list them out here and then we'll jump into each of them. So eosinophil count and FeNO. The second one was bronchodilator reversibility plus spirometry. Right. The second one is peak expiratory flow. And the very last one is bronchial challenge testing. Okay, so let's have a look at eosinophil count and FeNO. All right, so we've understood by now that asthma is a chronic inflammatory condition of the airways. Okay, now eosinophils is very important player in asthma because eosinophils usually increase when in response to certain allergens, in response to certain parasites, and also some types of infections. Okay, now the allergens is the main player within asthma because those are typically the triggers of the asthma itself. So as a result, what we can do is we can measure the level of eosinophils within the bloods, right, within the patient's blood. And what this means is that if there is an increase in the eosinophils within the patient's blood, that can point towards the diagnosis of asthma. Now, what is FeNO? So, FeNO stands for fractional nitric oxide. Okay. Now, both eosinophil and the fractional nitric oxide, they play a role with each other. So what happens is within the airways, naturally the airways produce nitric oxide, right? So the smooth muscles within the airway produce nitric oxide. Okay. Now, when there is an increase in the eosinophils within the smooth muscles of the patient, the eosinophils will increase certain enzymes, okay, that will then increase the level of the nitric oxide within the patients, right? Now, how do we actually measure this? So the patient will be given a certain device, almost like a breathalyzer, but the patient will exhale into the device, and that will pick up on the level of nitric oxide that is being exhaled. Now, because we mentioned that the eosinophils will increase the level of nitric oxide to confirm, the diagnosis of asthma, the FeNO is usually higher within patients who have asthma. Okay, so that's the very first one. Now let's look at the second one, which is bronchodilator reversibility with spirometry. Okay, so let's have a look at what this is. So we've also mentioned, with asthma itself, that it is it's a condition in which there is hyper responsiveness and reversible bronchoconstriction, right? That is the main, the main hallmark of what asthma actually is. It is reversible bronchoconstriction, okay? So what we're essentially doing with these testing is trying to elicit the reversibility aspect, right? So we're trying to check if there actually is, the airways are able to expand and constrict. And if they do, then we can, confirm that asthma is the diagnosis. So what happens with spirometry, right? This is an important point to mention, is spirometry will measure the patient's FEV1 and the FVC. Okay. Now, what is the FEV1? Okay. So the forced expiratory volume, okay, within 1 second. Okay, so this is the level of volume, or the volume of air that a patient expels, right, within 1 second. Okay, so this checks for the level of obstruction within the patient's airways, right? And as we've mentioned previously, asthma is an obstructive condition, so this will check the level of obstruction within the patient's airways. FVC is force vital capacity, okay? So this is when the patients will take a deep breath in and expel all the air out. So it's not within just 1 second, it's all the air they can expel, and that checks the vital capacity, okay? So both of these are what we measure within spirometry, and what happens is we take these two as a baseline test, okay? And what we then do is give the patient a bronchodilator, right? And when we give the patient a bronchodilator, we typically wait, 10 to 15 minutes, right? And then what we do is we repeat the tests again of spirometry, right? And we get both of these measurements again, the FEV1 and the FVC. And if it shows that there is an an improvement within the FEV1 and the FVC, then we know that the bronchodilator has actually worked and it's expanded the airways within the patients. And like we've mentioned, it's reversible bronchoconstriction, so that would also point towards a confirmation and a diagnosis of asthma. So let's just go back quickly. Peak expiratory flow, that is the next one. Peak expiratory flow. So what is PEF? So peak expiratory flow is interesting because this investigation is typically reserved for patients who have already had a diagnosis of asthma. So this isn't typically, used for the diagnosis of asthma itself. We use this to, measure how the disease is actually progressing for patients, and depending on the measurements of the peak respiratory flow, we can then tailor medication and adjust dosing based on how the condition is progressing. So what actually happens with peak respiratory flow is that a patient will be given a device, right, with a cardboard tubing at the end, so right here, and the patient will then blow, so exhale in air into the device as hard as they can after a deep breath in and one big exhale, right? And the air that they've expelled will push this little slider across the device, right? And the device will be measured, it will have metrics along it, which we can then write down, okay? And using those metrics, we can then tailor, medication and dosing for the patient. And the very last thing was bronchial challenge testing, okay? So bronchial challenge testing. So what is this? So very much like the bronchodilator reversibility, this is essentially the inverse of that. So we're trying to test the level of constriction and the hyper responsiveness of the airways itself, right? So rather than trying to test the patency and if it irreversibly constricts, we're trying to see if the patient's airways actually are hyper responsive to certain inhaled substances, right? So what happens is the patient will inhale substances such as mannitol, right? And when the patient inhales these substances, we will give them at different doses, right? So we'll give them at this dose, at this dose, and at this dose, right? And at each step of the dosing, we will measure with spirometry, okay, to check for the patient's lung function. And when this actually happens is we can see that at lower doses of the inhaled substance, that the patient will have a decrease in the lung function itself, measured by the spirometry. And if that happens, then that confirms that there is hypersensitivity for the airways, which will then confirm the diagnosis of asthma. The thing with bronchial challenge testing is that this is typically reserved for last line. So this is for patients who have persistent symptoms of asthma, but yet they haven't been able to confirm diagnosis using the other three investigation procedures. So this is typically reserved for patients who have persistent symptoms but have not had a definitive diagnosis. All right, thank you everyone for watching this video. That wraps up the investigation procedures of asthma. In the next video, we're going to look at the management options for asthma, and we'll look at the different types of drugs and medications that are actually available for patients who have this condition. So stay tuned for that, and thank you all for watching.